Many people think about high cholesterol as related to the types of foods that you eat and that then contributing to the higher cholesterol levels in the blood. But in fact, it means that you inherit the inability to clear the cholesterol from your bloodstream normally. And usually, when this occurs, it means that a parent is affected, so either a mom or a dad. Now, familial hypercholesterolemia is unique in that not only is there a greater risk for abnormal clearance of cholesterol from the bloodstream, but as a result, that cholesterol can then seep into the walls of the arteries and cause increased risk for premature heart disease. And so it's a preventable cause of premature heart disease if diagnosed and treated appropriately. FH affects 1 in 250 individuals, regardless of background. There are some subpopulations where the prevalence may be higher, but overall in the world, it's about 1 in 250 individuals, and that's including those who are of the African diaspora. The first and foremost class of agent that we use to treat familial hypercholesterolemia is something called a statin. They help to lower the amount of cholesterol in the bloodstream. They also help to upregulate the presence of the receptors that are critical for removing that cholesterol from the bloodstream. And in general, they work quite well. If there's a family history of premature heart disease, meaning someone in the family has had a heart attack or stroke or peripheral artery disease or stent placement before 55 years of age in men or before 65 years of age or premenopausal in women, then we recommend that kids are screened at 3 years of age. And that's because we're looking for a very specific entity. So if a child has a mom and a dad who have familial hypercholesterolemia, they're at risk for what we call compound heterozygous phenotype. That means they inherit 2 bad genes. And if they inherit 2 bad genes, they can have even higher levels of cholesterol at a very young age. So LDL, bad cholesterol levels of 400 or more at 4 years of age. It's recommended by the American Academy of Pediatrics that all children, regardless of family history, undergo lipid testing between 9 and 11 years of age and 17 to 21 years of age. So we, in our institution, we are working with pediatricians just to make the education more widely available about FH. I really do think that if more people knew that FH exists, that they would comply with the recommended screening. And I think people don't think about the fact that there's a possibility that this individual has this genetic form. Whether it's FH or long QT syndrome or some sort of genetic cardiomyopathy, we have a unique opportunity as pediatricians to not only influence the life of our patient, but we have the opportunity to influence the lives of their families, the life of the child, but also the life of the parent, their siblings, their parents. And so it's important that we recognize that there are conditions that cause the cholesterol to be high that are not related to diet, that are in fact related to genetic cause. And therefore, we must recognize them, not only for the sake of the child, but the sake of their parent. I think that the most important takeaway point regarding familial hypercholesterolemia that providers and families alike need to be aware of is that the treatment is not lifestyle alone. Lifestyle is important, but you do need medication to lower the cholesterol levels. We know now that it matters how long your cholesterol has been high, and it matters how high your cholesterol is. And so it's what I call the area under the curve. How long, how high. And that is what leads to the increased risk for premature heart disease. The unique thing about something like familial hypercholesterolemia is the levels are high at a very young age. And then you have that lifespan, including during a child's early life, where the levels are high. And that child is constantly exposed to these high levels. So I hear providers and families alike expressing concern about the treatment for familial hypercholesterolemia and the fact that they are not so thrilled about having a child to take a medication. But there are situations and conditions when the best treatment is a medication, and we have to acknowledge that familial hypercholesterolemia is one of those situations.